Namaste. This is Dr. Hema Divakar at the 5 points, 5 questions, 5 responses initiative from Health for Her. Well, there are many myths and misconceptions, especially when the doctor's advice doesn't go with what you have always heard. In the context that your sugars have been tested as being in the higher level than normal. Question number one: is it not right that the pregnant women should eat for two? Why is the doctor asking me to restrict my eating, especially with the things that I love? Well, the response is that your aim should be to maintain your sugars in the target level so that your baby does not recognize you have a high sugar and it does not get influenced with the adverse or the side effects of the sugars being very high. So it's a myth that the pregnant women need to eat for two, especially in cases like yours when the sugars are high. The focus should be on maintaining the sugars to as near normal as possible. Question number two: total energy requirements for a pregnant woman is 10 times more. Is that not true? Yes, that is true. You are right. Therefore, we encourage you to eat more of proteins, a little bit of fat, lots of salads which give you vitamins and antioxidants, lot of cut fruits with the skin, such as apple, which contains a lot of fiber besides the vitamins that it supplies you. So you will fulfill your calorie requirements, but at the same time, you will avoid a high rise of sugar by eating indiscriminately on the sweets and the carbohydrates. Question three: I have not gained any weight in the first 3 months of pregnancy. Is it not a bad start? The response number three is not at all. In fact, there's usually no weight gain in the first trimester or the first 3 months, as we call it, and slowly the weight starts escalating in the next 3 months, which is called the mid trimester of pregnancy, and also the last 3 months. On an average, any normal pregnant woman is allowed a weight gain of 10 to 12 kilos. But if your sugars are high, you must, and surely you must restrict your weight gain in the range of 6 to 8 kilograms only. So pay attention, visit after visit, to the amount of weight gain. And if it is escalating, pay more attention to your diet and sugar levels and see to it it is in the range of 6 to 8 kgs. Question four: what is low glycemic index foodstuff? What if I eat a Marie biscuit or two as against nuts and almonds? Well, the response four is that nuts and almonds typically are the ones with low glycemic index. The moment you eat them, the glycemic level, that is the sugar levels, does not rise sky high. Whereas on the contrary, cake or a pudding or a gulab jamun or a sweet, for example, inclusive of the benign looking Marie biscuit, which you may like to snack in between, you will need to restrict or not at all use them, because these are typically with high glycemic index. The moment you take them, your sugars will shoot up and your body will not be able to contain or maintain the sugar levels normal. Well, the last question, point five: what if there is a craving for substances which are sweet, which I have always loved, and everybody at home is saying that I'm overreacting to the doctor's advice and literally starving myself? Response five is that yes, you must maintain your calories, you must not starve, that is correct. But at any cost, under any temptation, this is just for a short period of time for the sake of your babies. Please do not eat any amount of carbohydrates or sugars that your body finds it a challenge to handle, and your sugars go haywire and it impacts both your well-being and the child's well-being. That's a complete no-no. You try and manage with the other kind of food stuff which will anyway maintain your energies without harming your baby and yourself. So with this, it is important to also expedite the outflow of your energy, the calorie out by way of exercises and the workouts and the yoga, because the more briskly you walk around, the more active your insulin secretion and action is, and more under control your sugars are. So here we close the 5 points on myths, misconceptions, and the care you must take if you have high sugars in your pregnancy.